Okay, so we are going to go over some ankle strengthening exercises. So if you've rolled your ankle or sprained your ankle, chances are you have done what's called an inversion ankle sprain, which means that these ligaments on the outside here have been stretched out. So what we're going to do is go through some strengthening exercises for the outside as well as for the inside. So taking a looped band, we're going to take that looped band and figure eight it, and then put it around the feet and put it at the distal end of the foot here, okay? So if you have a foam roller or some way to, go ahead and lift the legs up, some way to elevate the feet, you'll be able to work through a fuller range of motions. So press both of the toes down, so keep those toes pointed down, and I want you to twist one ankle out, but keep this one still, and then come back in. Twist out, stay on the right side here, twist out, and then in. Good, twist out, and then in. So right now, the left side is the stabilizer, the right side is the mover, twist out. That motion is called eversion. Keep those toes pointed. Good, take a break from this side, let's move to the left side. So now the left side is the mover, the right side is the stabilizer. Twist out, keep those toes pointed down. That's it. 2, 3. So you should feel like these muscles here are working. Good, now take a break for a second. So now you're gonna bring both feet up into this position, again, keeping those toes long, and now twist the right side out again. So what you wanna look for with this one is to make sure that that hip isn't creating that motion, but it's truly an ankle mobility drill here. So feeling this on the outside of the ankle, these can be done most likely, it's maybe 3 days after an ankle sprain, depending on the discomfort. So watch the toes. So you don't want the toes to do the work, but you want the ankle to do the work. That's it. Good. And when you get good at this, you can do the two together. So go ahead and twist both of them out. Keep those toes long. Keep the toes long. Longer. Yes, like that. That's it. Keep the toes long. So what's happening is Avery's using some of her toe extensors instead of her ankle, which is very common, so be aware of that. Good, so that's called eversion. Okay, post ankle sprain, we can do an eversion exercise, which was the first video. This is the second exercise, and this is inversion. So keeping that looped band in a figure eight, cross one leg over the other. Which one you cross over, doesn't matter, whichever way is most comfortable for you. And for this one, you can actually do the two together. So go ahead and twist out and then in. Just make sure you're getting your full range. So pause for a second. Let's have you move the legs a little farther apart from each other. Good, okay. Now, in, that's it. So this is called inversion, even though it looks like your feet are going out, it's because your legs are crossed. So now you're primarily working a muscle called your posterior tib, feeling this on the inside of both ankles. Again, be aware of the toes. It's less likely you'll try to use the toes for this one, but be aware that this is meant to be an ankle exercise. Good. So that's called ankle inversion with resistance to help post ankle sprain. Okay, so here we go. With the band, you need a buddy for this one. You're going to use the band around the midfoot. And then again, with your ankle free, go ahead and pull that ankle up and then extend back out. So I'm just going to readjust here. So try not to use so much toes and try to keep the toes pointed and then pull the ankle up. It's a little better. Keep going. Keep those toes long. So you should be feeling like the muscle in front of the shin is firing. So this is what's called resisted dorsiflexion. And really try to keep the toes pointed. Try that again. Oh, that's even better. Good. Keep the toes pointed. Yes. As you pull up, you should feel like the anterior tib has to work a little harder. Good. So this is part of the ankle rehab post ankle sprain. Ankle rehab, you want to foam roll the outside of your legs so that you can, if there's a high ankle sprain or any tension or issues with the fascia on the outside of the leg, that you can help to work through some of that. So to do that, we're going to use a foam roller here. So Avery's going to be on her side. Good. And then go ahead and foam roll the outside. So with the legs crisscrossed, you're getting the inside of the top leg and most importantly, the outside of that lower leg. And work your way all the way up towards the knee. So you may have to divide the outside of the leg into two sections. Yep, and then roll that outside there. It should feel a little bit tender, particularly around that bone, that top of the fibula. So if there's some sensitivity there, that's pretty normal, okay? So obviously you want to do that one on, especially on the ankle that is sprained, but it would be a bad idea to do it on the other side as well. Okay, so foam rolling, and how long do you foam roll? Typically 8 to 10 sweeps in each area. I would divide the outside of the leg into 2 sections, so 8 to 10 sweeps in the lower half and 8 to 10 sweeps in the top half. So this will help to flush out any congestion or any irritation of the fascia of the perineals, which are the outside of that lower leg. All right, now we're working in standing, working on plantar flexion. So with your knees straight and your toes nice and separate here, go ahead and float the heels up and back down, keeping the knee straight, float the heels up. Good. So that's a double heel raise, so up again. One more time. So being aware of what the ankle positionings can be helped with using a ball. So we're going to use, this is a 2-pound weighted ball, but any smallish ball will do. And then float the heels up. And as you come up, really squeeze that ball and come back down. And then come on up and back down. So this is going to be more advanced than the band exercises. Keep those toes nice and long. And then come on up and back down. The ball is going to help with the alignment of the ankles. So that's primarily working the gastroc. Now I'm going to take this ball out, bend the knees, good, and then don't let the hips come up high, but just lift the heels up, 1, and then the other, and then do the 2 again. So this is isolating the soleus. So do a single, single, and double. So if the ankle is irritable, if you have a fresh ankle sprain, this is not going to feel good. This is more like week to 10 days out based on the degree of, you shouldn't be limping. When you're getting to this exercise, it would be way too much. But that's a more advanced exercise, but working on the deep soleus muscle. The first one to start off would just be, just go ahead and go back to that first one, is double heel raise. So go ahead and float up. Good. And that's a good place to start. Then adding that ball if you feel like the ankles aren't staying in good alignment. And then the most advanced one is the soleus rise. Good. Okay, so that's more advanced ankle rehab after a rolled ankle or sprained ankle. Okay, so take this spiky ball and I want you to put this right underneath your foot and I want you to roll back and forth, side to side. So you're doing this in sitting, so there's not a ton of pressure through that foot, but if you've never done the spiky ball, this is a good place to start. If that doesn't feel very sensitive, like you're not having any discomfort with it or finding any trigger points, then you would want to stand up and put some more pressure through that. It's a good idea to do the spiky ball before the next exercise, which is we're going to do some toe exercises. We'll do some toe swaps and some doming. So spending 30 seconds on each foot to warm up the muscles of the arch and the foot are a good idea before we move on. So after you do that, we can go ahead and do the toe swaps. So with the toe swaps, you want to keep those toes nice and separate. Good. And now keeping the big toe mounds down, lift the 4 small toes up, and then back down, and then switch. And then switch. Good. So you want to be careful that that ankle isn't doing the motion. Better. So watch the ankle when you're doing that one. So Avery's done these before, so she knows what she's doing, but when you first do this, they're probably not going to look as good as this. So it's sometimes helpful to use your fingers to help the dissociation between the big toes and the 4 small toes. And if you do that first for a couple days, you may find it's a lot easier. Once you've mastered that, then you can move on to doming. So with the doming, again, you want to separate those toes. You want to make sure that you can see the toenails the whole time. Drag the toes back, creating that beautiful arch, little mouse hole here, and you can see these joints popping up. And then extend the toes back out, drag those toes back. You should feel like the muscles of the arch are firing. Sometimes you'll even feel a cramp in the arch, and that's because you're activating muscles that aren't used to firing. So spiky ball first, then move on to toe swaps, and when you're feeling comfortable with the toe swaps, then go ahead and do the doming. Doing the two together is a good idea just to be efficient. One foot actually can help the other, but if that's too complicated, you just want to do one foot at a time, that's fine as well. So this is another part of the ankle rehab because your toes and your feet are important for your ankle function. So give that a try. Good job. As an alternative to doing inversion, where you're crossing the ankles, you can do it in sitting here. So you have a band wrapped around your midfoot and then around basically that knuckle that sticks out. And now I want you to twist that foot up and in and then back down. Good. That looks perfect. So the muscle that you're primarily activating here is your posterior tib. So that's the inside of the ankle. This muscle helps to support the arch as well as the ankle. And Ava's doing a nice job of keeping those toes nice and long. You want to make sure you're going through the full range, which means you're going from one end all the way to the other with a little twist. So try to twist just a little bit more. That's it. Well done. So in terms of number of repetitions for these, I would start around 10, work your way up to doing 20. Give that one a try. Doing heel rises, it's important to restore the length of the calf muscle. So to do so, you're going to come into this lunge position, bend that front knee, back knee is straight so that you feel that stretch through here. So holding that stretch for 30 seconds is the first part of it, and then taking this foot after 30 seconds, move that foot 2 inches ahead, bend that knee so that you're feeling that stretch deeper here in the deeper calf muscle called your soleus, maybe a little bit more in the Achilles. It's okay if the heel comes up a little bit as long as you're feeling the stretch sensation here. So after doing the knee straight and the knee bent, if with either of those you're feeling a stretch or a pinch in the front of the ankle, then you want to come down into a kneeling position. So start off just like this. So for some people, this may be enough to feel that stretch sensation in the front of the ankle. If you're not feeling that stretch, then go ahead and lower your bum down towards your heels or stopping anywhere along the way. So again, you're feeling the stretch in the front of the ankle. What can happen here is the foot wants to turn in, so you may need to turn that foot out a smidge so that you feel the stretch throughout the whole front of the ankle. So that can be some impinging that's happening, and you want to address that with this kneeling stretch. So give those 3 ankle stretches a try.